Hello, everyone. Welcome to Why Wellness. I'm Gina Rose, a certified personal trainer and fitness nutrition specialist, and I created this platform for so many of us to share our why. Oftentimes, we hear this buzzword question in the health and fitness industry, and I couldn't think of a better way than to compile our stories right here on my podcast, Why Wellness. We're here discussing inspiring, relatable, and motivating stories from health and fitness professionals across various platforms. Please subscribe, rate, and share my podcast. It would mean so much to me. I can't wait to share this next episode with you.
Welcome back, everyone. This is Why Wellness with Gina Rose CPT. I'm so excited to get back on with you guys and introduce my next guest. This is a friend of mine, and he has so much to offer. He is a board-certified pediatric dentist. He is faculty at Temple University Kornberg School of Dentistry. He is the owner of Happy Teeth Pediatric Dentistry, and his name is Dr. Amar Singh. Thank you so much for being here today. So excited to have you.
Gina, it's an absolute pleasure. Great seeing you again. Thanks for having me on. This is awesome.
Yes, and it's so cool that we get to dive into like these different spaces with this podcast. So, why wellness is so broad in terms of, whether it's fitness, whether it's physical therapy, whether it's medical. And then I don't think a lot of people would think to add in this dentistry part, but I know that there's so many benefits, not only, personally with your journey, but also in the practice that you're able to give every day. So I really wanted to start out with just a little bit, if you can tell us, kind of about your own personal journey to ending up where you are today as a dentist.
Yeah. Well, I think with all of us, I think our story usually starts even before us, probably starts with my parents. So my parents, born and raised in India, they both came here in like the late 70s, early 80s. They both came from very humble beginnings. And one thing that was just really instilled in me early on was this idea that everyone is the same. So don't ever think that anyone is above anyone else. So the person that cleans the hospital is as important as the doctors and the nurses that work inside the hospital, the administrators that work there. And my father's a physician. He's a pulmonologist. And I knew that healthcare was always going to be something that was really interesting to me. I really saw how deeply my father cared about his patients and his line of work. And it really reflected in terms of whenever I would go to his office or the hospital, seeing his patients just be really grateful for all he would do for them. And that always resonated with me as having some kind of first-hand patient care. But I also knew that when my brother and I were growing up, we played a lot of sports. We played basketball, we played soccer, we played all these different things. And my father, while he was working so hard to be able to provide a life for us, he wasn't able to attend all of these games and things that were really important to us. So I knew that as important as healthcare was going to be for me, I wanted to do something that was going to allow me to have and family time as well. And so I wanted to have something that provided me the opportunity and the luxury of treating patients, but also allow me to have a good amount of time at home with my own loved ones. And between that, starting the journey towards healthcare, I had a cousin who kind of fell into dentistry. And the more I talked to him, the more it seemed to be it was compelling to me. And I learned more about it, shadowed a few dentists. And before you know it, just ended up taking the DAT and just, man, crazy to believe, but that's 12 years later, just still chugging along.
Yeah. So you were pretty young then when you were like in and around like those medical experiences with your dad. Like about how old would you say you were?
Oh man, I was, I think probably around like 7 years old. I think is 7, 8 years old, probably around the time that I first went to my dad's office and just kind of checked out what that looked like.
That's awesome. So cool. But you also now personally take your health and fitness pretty seriously, right? Like, so I know like you work out, you go to the gym. How does that play a role in also the healthcare path that you chose? Because I think that you hold your health and fitness to a high standard personally, not just professionally.
Yeah, I think it's all connected. So I think just how the mouth is connected to the rest of the body, I think everything is all works together, right? So if I'm going to preach, a big part of dentistry is not only oral health care, but also nutritionally, making sure kids are eating healthy foods. And we'll talk about all the dietary stuff that I recommend for them. But if I'm going to be preaching that, I also want to make sure that I do the whole thing myself. So eating well, exercising regularly, drinking lots of water. These are all things that are mantras to me. And we're only given, I think I heard Warren Buffett give the example one time of, if you were given a car, any car that you want, but the only stipulation is that one car has to last you for the rest of your life. How are you going to treat that car? You're going to get the oil changed so regularly. You're going to get it tuned up. You're going to do everything you can. And every single part of you is going to be consumed to taking care of that car. Well, we all know that, and that's really obvious to us. But when you think about your own body, we sometimes don't treat it with the same respect that we really should. Yeah. So I try and do that. I try and just exercise well, try and do 4 to 5 times a week, drink as much water as I can, and really try and limit the amount of things that I would consider like deleterious to my body.
Yeah, that's a great analogy. I don't think I heard that one, but it's like, yes, we only have one place to live in our lives, and that's our own body. So we might as well, treat it well. So you touched on it a little bit, and I wanna dive into it a little bit deeper about how healthcare is about all parts of our body and how it goes hand in hand. So how does the health of our teeth or the health of our mouth overall kind of play into the bigger picture of our overall health? So how can it positively or negatively affect other parts of our body? Yeah.
So for starters, the mouth is really one of the first places that diseases manifest themselves. So while I'm a pediatric dentist, adult dentistry too. So if a patient is coming in and they have sores in their mouth, bleeding gums, periodontal disease, and they seem to be taking really good care of their teeth, there's probably something else going on. So there's a lot of times that there may be first signs of diabetes, heart disease, leukemias, cancers. All of these things tend to be manifested and show up in different parts of the body. The mouth is no different. And again, remember, like you said, everything's connected. So if you have a dental abscess in your mouth from not caring for your teeth, that bacteria is just going to proliferate. It's going to get bigger. It's going to spread. There's been, unfortunately, very sad cases of kids dying from untreated dental decay just from abscesses that have traveled from the mouth into the bloodstream, into the brain, and kids have died. So we as people should not only understand the importance of us and treating our own mouth and our own oral health seriously, but also for our children, understanding that it's not just toothbrushing and floss, it's also eating healthy, getting regular checkups and cleanings, and drinking lots of water. Other ways that our mouths can, take care of or hurt our other parts of our body. Periodontal disease is just a proliferation of a bacteria that can essentially eat away at the bone that's holding your teeth inside your mouth. So if you are not taking care of your teeth by not flossing, that bacteria starts to, proliferate, get deeper, start to cause periodontal abscesses in your mouth, and you may end up needing to have teeth extracted, which then, if you have teeth extracted at an earlier age, now you're talking about dentures. You're not necessarily able to eat and get the same amount of nutrition. And now we're talking about other, difficulties and systemically later on in life too. So It really is truly is all connected.
Yeah, that's crazy. So obviously, I think everybody knows the typical brush your teeth twice a day, floss, like all of that good stuff, like eat healthy foods. Are there certain foods, especially like for people now that are, there's so many different diets out there, whether, people are trying the keto diet or they're going vegetarian or vegan. I'm sure that the way that even like people chew, like what they put in their mouth can affect the mouth differently. Are there certain diets or foods that harm the mouth more, harm the teeth, or is there anything that you can speak to from that point of view about what we're actually eating?
Absolutely. So for starters, let's talk about what cavities actually are. So cavities are actually little holes in our teeth. Those are caused by acid in your mouth. The acid is actually produced by bacteria. So bacteria will use carbohydrates, simple carbohydrates, sugars, breads, starches, things like that, and it will use that substrate and essentially excrete or secrete this acid into your mouth, onto your tooth, and that acid is what ends up creating holes in your tooth, and that's what we call a cavity. Now, there's going to be things that increase the acidity in our mouth, so even eating acidic things, so lemons, things like that, will lower orange juice, things like that tend to lower the pH of your mouth. So if you do drink juice, if you do, eat lemony, citrusy things, you always want to wait at least 60 minutes before brushing your teeth, because you can actually brush that acid into your teeth and are harmed. So if you're chugging a glass of orange juice before bedtime, you definitely do not want to brush immediately afterwards. You want to wait as long as you can. The biggest thing that I tell the patients and the parents is it's not how much juice or sugar or milk it is that they drink, it's how frequently they're drinking it. Mm-hmm. So one glass of juice drink with breakfast, lunch, or dinner is actually way better for you than that same cup spread out over the course of an entire day. So our teeth constantly undergo remineralization and demineralization, meaning that if you're drinking sugar, your teeth will then be coated within that acidic kind of medium, and that it will slowly start to demineralize, meaning that it's going to be easier for cavities to happen. Well, if we wait a little bit, those teeth via the saliva, other things, water that you're drinking, are going to remineralize. But if you're constantly drinking juice, drinking milk, drinking juice, drinking iced tea, drinking soda, all that sugar is going to constantly demineralize and demineralize and demineralize until you're left with a lot of weakened enamel. And that weakened enamel are just targeted spots for that bacteria to go in and cause cavities. So whatever you're going to eat with your breakfast, lunch, dinner is fantastic. Fine by me. Have as much as you'd like. In between meals, that's when you really want to be strict about what it is that you have. So water should exclusively be drank in between your meals. If you're going to have something outside of water, it should really only be at mealtime. And then for your snacks, you should be having something healthy. Cheese, fruit, yogurt, vegetables, those are all really good snacks. Even though fruit is high in sugar, they are natural sugars, and in terms of staying on top of your teeth, those fruits tend to wash away a little bit easier. Things that are dried fruits, carbohydrates like chips, cookies, crackers, those things tend to stick and stay on those teeth, and they tend to last a little bit longer.
I did want to ask you, because you mentioned a couple of times starting out like young and like what kids are eating, because obviously you're focused on pediatric dentistry. What made you decide to go with pediatrics instead of adult dentistry? You just like kids better?
I mean, it's not even close. Like, I have all the empathy in the world for a 5-year-old that's terrified of coming to see the dentist and what it's going to be like. I will sit for an entire day and just be with them and just coach them through it. If you are 45 and are just, I just can't, I have no patience for you, sir. I don't open your mouth, Craig. I have no words for you, sir. Kids are just awesome. I love how their minds work. They're just so creative and just awesome. You can really coach a kid through anything in terms of like from a dental procedure. Adults always have their own like biases and stuff that kind of happen to them, and they're just some can be very difficult to work with. Yes. I find kids to be just fun to be around. It's just, the day just ends up being a lot more lighthearted and fun, and it's also there's probably no greater feeling than having a really scared kid that comes to you that has like a dental abscess that can't eat, and the same day you can relieve their pain and also relieve their anxiety for future visits. It's like, and then a kid can give you a hug like after they're done, like that wasn't so bad after all. Like it's the greatest feeling in the world. So it's great for my other dental school classmates think I'm insane because they can't imagine working on kids, but I'm glad they have theirs. I have mine. So it all works out.
Yeah, no, that makes total sense, and I get it. But I'm kind of the same way, like when I go to get my teeth cleaned, which, by the way, I go every 6 months to get my teeth cleaned. So, which is air high five. But I still get nervous every time I go. I mean, like, what person enjoys someone scraping their teeth with like metal, whatever? Like, it's just not. It's not fun. So I just
don't influence your listeners like that. All right, don't listen. It's a great time. We'll call you princess, right? We'll give you a toy after you're done. You watch TV. It's great. Dental care has never been better.
Yeah.
It's never been a great time to go see your dentist.
It is. And I mean, as much as I don't enjoy it, I still go every 6 months and make sure that I get checked up on. Now, this is something that I bet a lot of people have interest in now, more so like as an adult, about white teeth, like teeth whitening. Like that's like such a thing these days. And so I personally have tried like Crest white strips. I've done the charcoal powder, like just like scrubbing that on my teeth, and like my whole mouth and like sink is black. So what is your take on like teeth whitening? Can you explain to us like what is really happening? Because some people say like it damages your enamel, or, the process of trying to get white teeth is actually more harmful than it is doing you good. And is it even possible to get a whiter smile? Like, what's your take here?
Yeah. In-office bleaching and at-home bleaching are both totally safe, totally fine to do. I always recommend at-home over-the-counter whitening first, because everyone has different sensitivity levels on their teeth, and there's no question about it. Bleaching does make your teeth more sensitive. Now, the amount of sensitivity that increases totally depends on the person, totally depends on the concentration of bleach that you're using, but it does increase the sensitivity. So I always recommend over-the-counter ones first, because they're much weaker in terms of the amount of bleach that is used. And some people that are very, very sensitive might notice some increase in sensitivity with the at-home ones, in which case, great, do not do an in-office bleaching, because it's just going to end up being worse than that. I always recommend the at-home ones first. You can use the in-office bleaching. You can get really, really good results with it, and it does not damage your teeth, provided that you wear it for the prescribed amount of time, which is usually about anywhere from 15 to 30 minutes to 30 to 60 minutes, depending on the bleach concentrations.
Okay. My dentist must not do in-office bleaching or whitening, because every time I've asked my dentist, he's always like, oh yeah, just go get the Crest white strips. Like he never offers that there's an in-house option. So I'll have to ask him about that.
Yeah. I got something for you too that we'll discuss.
Oh, okay. My listeners might be jealous.
Yeah.
So actually, I forgot to mention this at the beginning during your introduction. But for everyone listening, my friend, Dr. Amar here, is actually a comedian, and he's super funny and he tells jokes. And I wanted to know if you have any dentistry jokes.
Well, one of my guilty pleasures is because I've heard every dental joke now. So every kid wants to come in. Well, the really funny one, my favorite kids, come in and they say like, Dr. Amar, I have a great joke for you. And I was like, okay, great. Can't wait to hear it. And then they go, what time is a dentist's favorite time of day? And then before they say anything, I go, 2:30. And then they go, I was like, you got to get up earlier if you're going to get one over on me, kid. Come up with fresh next time.
That's awesome. I've never heard of it. I've never heard that. Okay, 2:30. I'm writing this down. Like, I'm going to need to repeat this joke sometime.
Next time you go to your dentist that doesn't do bleaching.
Yes, I'm gonna ask my dentist. Hey, so wait, how did it start again? What's a dentist's favorite time of day? Okay, got it.
Which would be least favorite time of day? Because I mean, I'd like to get away from the stereotype that we all just want to like inflict pain and we're all like this or sadists. Or what's the difference? Or what's the one inflicts pain? That one.
Exactly.
We're not. We're good.
That's awesome. No, thanks for sharing that. So, let's talk a little bit about mindfulness. Do you practice in any sort of like meditation, yoga, what helps you relax and kind of like forget the day-to-day stresses that you might encounter?
Yeah. So actually, there's been, so much hardship and just heartache that's happened with with COVID and with the quarantine and everything like that. But one positive thing that came out of it for me was it was the first time that I really committed to doing yoga every day. So I'd start my day every morning. I'd wake up and then I went on YouTube and just searched yoga for beginners, and this yoga with Adrienne came up, and she does this like 30-day yoga thing, and I'm hooked. It was great. My neck has never felt better. I'm able to do my cat cow is on point, Gina.
Oh, are you inhaling and exhaling properly when you round the back and arch the back? Are you doing that correctly?
Let me tell you something. A cat and a cow they have never exhaled and inhaled better than me. I'm in and out. But that's been like something that's really been great and dentists. We all have like neck, shoulder, back issues. And so that's been something that I've been really thankful that I've been able to pick up with this whole kind of craziness that's been going on. And that has really helped me out a lot. And also I don't know if this makes me sound like a crazy person, but at the end of a long day of pediatric dentistry, sometimes it's kind of a loud day, and I will drive home, no music, no podcast, windows up, and just my thoughts, and just like allowing my brain to just reset to just nothing. And it's so calming. It sounds crazy because I've always loved just like blasting the music and listening to podcasts or an audiobook or something like that. But I'll tell you what, underrated. Drive home with no music, nothing, and just sit with your own thoughts, and you've nowhere to go but just kind of thinking about things. It is great. It's fantastic.
Honestly, I don't think that that's weird. I think that could actually be a lot of people's norm.
Really?
I mean, I'm not speaking from experience or anything. Well, maybe I am. I mean, no, I do that. I definitely really? Just don't forget that there's like other sounds that I could turn on. The radio's not on. Yeah, I do that. I do. So I guess we're both crazy.
Apparently, my friends think both of us are serial killers. That's like, they're like, no music. Like, it's nice. Try it out.
Well, honestly, speaking of music, so you might remember this about me. I am just the worst at finding new music, and I'm like kind of stuck in an era. Like, I will still listen to things that I listened to before and have no sense of like what's new or cool. So yeah, I think that I'm definitely someone who drives and doesn't realize that like there's no music playing until I'm like, oh, let me turn this song on that I've listened to already 1,000 times. But like, you're great at finding new music. How do you do that?
Spotify has just been the best. I have like a very particular taste in music, and then it'll just keep kind of recommending similar artists. I found Anderson .Paak that we both enjoy. Yes. I got some new people for you, Gina. I'll send them your way.
Okay. Yeah. I rely on Amar to send me playlists so that I'm not driving silently in my car for too long. Cool. Okay, so getting back a little bit into your story. So this podcast obviously called Why Wellness, and it's really about why people obviously chose the path that they were on, which we touched on in the beginning. But what is something that like keeps you going, right? What keeps you choosing this path?
Yeah. I think I've been very lucky that every couple of years I end up getting a different kind of a new challenge. So I graduated from dental school in 2012, residency in 2014. And then I moved to Philadelphia and started working at a private practice. So that was cool. I did that for a couple of years. Then I went back and started teaching. So that was cool. I was doing that. Then I changed to a different office, and then so sort of seeing how different things kind of run. And then I opened my office in 2019. So now that's been such a great additional challenge because not to pat myself on the back too much, but I feel like I'm a very good pediatric dentist, but I really know nothing in terms of running a business. So that's been a totally new challenge for me. Listening to more business podcasts, how to run my business more efficiently, how to get my team to be involved and care about this office like it's their own. And I think one thing that we've consistently gotten back from feedback from our patients and our parents is that everyone truly is like bought in to this office, and everyone loves coming into work. When we were away from each other, we had to shut down for 10 weeks because of COVID. We all just kept in touch and kept just sending each other like memes and stuff like that. And when the time came back to open the office again, people were on unemployment. They were comfortable. They were taken care of, but they chose to leave unemployment and come back to work because I think we just have like a really strong, tight-knit family here. And that meant the world to me. Yeah. So that constant challenge of running your own business and trying to constantly keep the team morale thing is something that I think is kind of a lifelong challenge. And the beautiful thing about dentistry too is that it's a dynamic field. So there's constantly new technologies, new procedures, new techniques. One thing that we have been doing that I never did prior to owning this office are these infant frenectomies. So for these babies that are tongue-tied, they're not able to. So I should give a little backdrop. So everyone has these muscle attachments that connect our tongue to the floor of our mouth and our lip to our gums. In some patients, those attachments are very long and they haven't kind of dissolved away like they normally do. So when you think about your fingers, right, most people have these things, but some people have webbed fingers, right? So like this attachment, the skin ends up being a little bit higher. So a similar kind of thing happens in our mouth. Oh. Most people, it's not really a big deal if you kind of make it past however long, after the age of about 1 year old or so. Some people have major speech issues, so we can release it for them then. Some people have speech issues. Sleep issues, excuse me, where the tongue, instead of being able to rest at the top of the mouth, will actually end up protruding into the back of the throat. And so now they're having airway issues, sleep issues, waking up with migraines. These are, all things that are happening because the brain is not perfusing as much oxygen at night because the tongue is protruding and blocking the airway. By doing this simple procedure, what's called a frenectomy, you're essentially releasing the tongue from the floor of the mouth so the tongue is able to move independently. We do it a lot for infants that are having trouble nursing. So in order for a baby to nurse properly, breastfeed properly, they need to be able to move their tongue down and out, and they need to be able to move their lip up and out. And so by doing so, they'll be able to create an adequate seal onto their nipple. But if they're not able to do that, then what ends up happening is they end up swallowing a lot of air. The kids end up becoming much more gagging and refluxy, and a whole bunch of lifelong issues can tend to take place. So by doing this procedure, you're relieving all of these issues that happen. And these patients and these parents it's a life-changing procedure. And so that's just one example of the ways that dentistry constantly changes and just keeps you on your toes. And so I always challenge people to, no matter what field you're in, your field is changing. And in a time like this where technology is just changing the game every single week, every single month, every single year, stay on top of your field, whatever it is, because there's new procedures, new techniques, and you got to stay on top of them if you want to provide your customers whatever it is that you do it to the best of your ability. So that's what really helps me out.
Yeah, that's amazing. I had no idea about that type of procedure, and that's something that you do at your office?
Yeah, absolutely.
Oh, wow. Okay. And then you mentioned too about just owning your own business. That's something that obviously when you're passionate about something and something is your own, the reward of that feeling is something that just continues to fuel you and your team. And you've built something that other people can, have an income from, have a great lifestyle from, and support you. And that's gotta be a great feeling.
Unreal. Yeah. It's been awesome.
Cool. Is there any tips that you want to share for listening?
Well, I would love to talk for a few minutes just about fluoride, because it's such a debated, kind of controversial topic right now.
Okay.
Be able to just kind of educate a little bit about what fluoride does, why we use it, and all of that. So fluoride is a natural occurring element. It's on the periodic table. And it's in a lot of the things that a lot of the foods that we have, water that we drink. Fluoride is used in the dental field topically. What that means is we use it as a way of strengthening the outer enamel of the tooth. Okay, so there's several things that it does. So number one, it will inhibit demineralization of your tooth. So you remember we were talking about how certain foods and acids can actually just demineralize and start to like weaken your enamel. Fluoride will actually target those areas and re-strengthen and remineralize those areas of weakened enamel to make them strong again. It'll also promote, not only inhibit the demineralization, it'll also promote remineralization. So same kind of topic, just on opposite ends, right? So one kind of stops further problems from happening, and one builds on the outer enamel to make it strong. The enamel is the hardest mineral in the body. It's harder than bone. So it's made up from 96% of it is a mineral called hydroxyapatite. Again, it's the hardest mineral in the body. When fluoride is added to it, it actually undergoes a chemical reaction to form what's called fluorapatite. Hydroxyapatite is resistant to acid, but fluorapatite is actually 4 times more resistant to acid. So that's why after you get your dental cleaning done, they'll oftentimes paint fluoride on your teeth. And what that does is it essentially strengthens the outer enamel, and it's now going to make you, it's almost like a protective, like superhero coating on your teeth, as I tell my kids, that it just basically makes the teeth much, much, much more resistant to acid and getting cavities in the mouth. Now, I believe in the 1940s, 50s, somewhere around there, they noticed that dental caries was just becoming so rampant in different communities. And so they started to add a very, very tiny amount of fluoride into the water, about 0.7 parts per million of fluoride into the water. And that one single thing ended up being able to reduce dental caries amongst entire populations that had access to that water by about 50 to 90%. Decrease in dental caries just from that one simple addition. That then became, a big thing within the dental community, but it also became a cause for concern, rightfully so. What is fluoride? What does it do? What does it do to our body? Fluoride does get about 60 to 75% of the fluoride just gets passed right through you and doesn't get absorbed into the body. The 25 to 30% or so that does get absorbed gets absorbed into calcified tissues. So it doesn't go to your brain the way a lot of people think. It doesn't, a lot of these problems that people tend to say that fluoride causes, there's been no peer-reviewed scientific research that's backed any of that up. So although it is, sometimes you'll read some stuff online saying that, these were used in, internment camps and it causes laziness and dishonest. There's been nothing to show that, that actually happens in a peer-reviewed scientific journal. In terms of the, it is in a very, very small amount in water. So it's at a very, very safe amount. All water has been normalized to the 0.7 parts per million to 1 part per million. So there's no fear of getting too much of it. The fear of getting too much fluoride is what's called fluorosis. When essentially the teeth can get too much fluoride if if people are supplementing their diet with extra fluoride. So you can't get fluorosis from just drinking too much tap water, but you can get too much fluoride if you are taking fluoride supplementation in addition to already getting fluoride in your diet. What will happen if you get fluorosis or too much fluoride? If you get that extra fluoride while those permanent teeth are forming from around age 1 to age 7 to 9, you can get what's called fluorosis, or mild white spots, mild white hypocalcified spots on your teeth. That's really what happens with mild fluorosis. For that reason, I generally speaking don't prescribe fluoride supplements for my patients. I find that if we figure out what the dietary issues are, what the oral home care is looking like, if we're drinking lots of water, if we're avoiding sugary beverages, if we're avoiding snacking, if we're coming in for regular checkups and cleanings, that alone really can isolate and doesn't really necessitate fluoride supplementations. If the patient is still having issues after all of those things, then I think maybe once in my entire career I've had to, prescribe fluoride supplements, but almost never.
So why would someone want to take a fluoride supplement if they're not obviously getting enough fluoride from their regular diet or water that they're drinking? But so you mentioned fluorosis, which is too much fluoride, but what is happening if you don't get enough fluoride? What is that?
Yeah.
You said the white spots were fluorosis, right?
Yes, exactly.
Okay.
Exactly. And so some areas have non-fluoridated water. They have zero fluoride in their water. So if you actually Google this, I encourage your listeners to go ahead and Google non-fluoridated areas. I believe there was a study that just came out in Alaska not too long ago, where they compared very close areas, one with fluoridated water, one with non-fluoridated water. And really, to answer your question, dental caries tends to be rampant in the areas that
What does that mean?
Cavities. So just cavities just tends to persist in many more people in that population that does not have a fluoridated water.
Oh, you're saying dental caries? Is that what you're saying?
Dental caries. I'm so sorry. Dental caries is what we call the cavities is the.
Yeah, we don't know what that meant, because I heard you say it a few times. And I was like, what is he saying? So that's it. Okay, guys. So if we don't get enough fluoride, we're going to get more cavities. If we get too much fluoride, then there's a potential that we could get these like white marks on our teeth. But does this happen more so when you're younger?
Exactly. Yeah.
Okay. This is so cool. This is such good information.
Dentistry is awesome. It's super exciting. Your dentist loves you so much, more so than you even know, everybody. I want everyone to know that.
I bet.
So be nice to dentists,
Yes.
Come in, tell them that their hair looks great underneath all their stuff, their eyes,
Well, you know what? You don't get to spend as much time with your dentist. So you have the
hygienist.
The hygienist, who is really the one that you have to build the relationship with. So tell me about that, because it's like, you go in and she or he spends all of this time in your mouth. And I hate when y'all try and have a conversation. And I'm just like, like I can't say anything. But yeah, so it's that person. And then the doctor comes in and, like blows some air in your mouth and says, all right, see you in 6 months.
We have 4 years of dental school, and it's really different angles of blowing air in your mouth. We're really good at it though. Like insanely good at blowing air in people's mouth. No, and you raise a good point. So the hygienists, they're really the unsung heroes of every single dental office. I love every hygienist I've ever worked with. They do not get nearly the amount of credit that they deserve. They do a really good job of restoring your tissues, getting your teeth free of all that plaque, calculus debris, scaling down into like hard to reach areas for you, showing you how to floss. And they really do the heavy lifting. If you have no dental issues at all, my job is so easy. I come in, I just check to make sure that everything's looking okay, review oral home care, check to make sure that there's no like pathologies or kind of weird bumps or growths or anything like that going on. And our job is simple. Our job is really more so identifying problems and then fixing those problems. The hygienist is really more so about taking your tissues in your mouth and cleaning them and restoring them back to health.
Yes.
Both are very important.
Go hygienists. Woohoo!
Everyone knows.
So this is something that I thought of too. How about like teeth? Do you do anything in the realm of straightening teeth, or is that more so like orthodontics, right?
Yeah. So the beautiful thing about Gina, your dental knowledge
I'm actually a dentist, you guys. Like,
let me see you blow some air real quick. Let me see your thumb work. Yeah, that's it. Okay. Ready. So braces is what we call orthodontics. So that's the process of moving teeth around. So similar to how, and if you break a bone, you'll go to an orthopedist. Ortho means bone. Orthodontics is essentially the bones and the teeth. So moving the teeth and the bony structures around them to be able to align them to allow for more optimal oral health. Sometimes people have crowding in their mouth. They don't have enough space in their mouth for their teeth. So their teeth end up being a little bit in front, a little behind. I think everyone has a beautiful smile. I don't really tell people that they need braces because they need to look any particular way. But some people's teeth, when they're crowded together like that, they tend to retain a lot of plaque, a lot of food in between their teeth that can cause cavities, periodontal disease, gingivitis. So in those situations, it's a really good idea to separate those teeth and get them nice and straight so that they can take care of their teeth a little bit better. Orthodontists do only that. They only do braces. And they're really great at it. If you want like a top-notch care, you go to an orthodontist, they will do an excellent job. General dentists, pediatric dentists can also do braces. We can also do clear aligners, braces. And we're able to move teeth in a similar kind of way. But if you want the absolute specialists, orthodontists are the best in the game at it.
Gotcha. I was going to ask if there was like such thing as overbrushing. Like, can you brush your teeth too much?
Oh, that's a great question.
Oh.
So we actually, these are all great questions. So I may have to just do like a couple like FAQ stuff that like kind of always comes up. So great question. Can you overbrush? The answer is actually yes.
Okay.
So we always recommend every dentist will provide you with a soft toothbrush. The softer the toothbrush, the better it is. The reason for that is if you use a medium or hard toothbrush, you will actually rip away the gum tissue that's in between your teeth, and you can cause what's called recession. And your gums can actually wear away and actually will not regenerate the same way. And you're left with usually more sensitive teeth, sensitive gums. So you always want a soft, gentle toothbrush and just gentle circles. You're not scrubbing away your enamel. You're not kind of getting in there. All you need to do is just gentle, soft, circular motions to clear that plaque off. And then obviously you want to make sure you're flossing every night. So you should use fluoride toothpaste morning and night. You don't need a whole glob of it like the toothpaste commercials show you so that you can use up, 16 bottles a year. You just need a very tiny little bit. You're just using it really as an abrasive to be able to create a little bit of friction and a little bit of fluoride to bathe those teeth. You want to do that morning and night. After you're done brushing at night, you should not eat or drink anything. Go in with the floss. I do recommend flossing with the regular string. And I actually am going to get something that might help your listeners. Hold on one second.
Okay.
You ready for this? Boom! Right?
What is happening?
Kids love these.
So what is this massive mouth and brush that you have?
This is a little guide that I like to show my kids in terms of how to brush their teeth. So I just take this oversized toothbrush, and then I just like to show them that they should brush not only their teeth but also their gums, right? So you want to brush like this, so just soft circular motions, and you want to clean up the majority of plaque that builds up right what we call the sulcus, or like where the teeth meets the gums. So this little area is where that plaque usually builds up. So you just really want to angle your toothbrush into those areas. And then the top teeth all the way in the back towards your cheek. So that side that faces your cheek, that's where a lot of the plaque builds up too. So the front where the teeth meet the gums, and then the back where the cheek meets the teeth, like those back areas are really notorious. I was going to show you guys how to floss because this is such a common thing to have a hard time with.
Do you have floss big enough for this? Or is this regular sized floss?
Regular sized floss, and this is going to be like floss in the Grand Canyon, but we're going to figure it out. We're going to do just great. So, a lot of people use like those, the flossers that just have like the little handle on them and just kind of go in and out.
Yeah.
Grimacing right now, and I love every second. You're so like concerned about this patient of mine right now. I really appreciate it. So, not the best thing to do to use those little handles. I always tell patients, if it means you are either going to use the ones with the handle or not at all, use the one with the handle. It's better than nothing. But if you really want to take your oral hygiene to the next level, take a nice long string of floss. And what you're going to want to do is, I know this is hard for you to see, but I start with on one end and I loop around my finger, right? And then I have like this long tail. And then I start kind of like halfway down and then I loop there, right? And I'm left with a little string like this. And then every area that you floss, you don't want to like spread that bacteria to other parts of your mouth, right? So what I'm going to do is after I'm done flossing here, I'm going to wrap this side away and I'm going to unwrap a fresh piece of floss. Okay. So it's always a clean part of the floss that's going to be going into different parts of your mouth.
Yeah.
In your teeth, you should always use clean floss. All right. And then what you're going to want to do is you're going to want to take the floss and you're going to want to put it between each space 2 times. 1 time for one side of the tooth and then 1 time for the other side of the tooth. So here's what I mean by that. So let's put this like this. This is so awkward. What I'm going to do is I'm going to get the floss down here and I'm going to curve it this way, right?
Oh, can you turn people's like whole heads upside down like this usually?
I'm blow air and I turn people upside down when they come in and see me. Happy teeth, buddy. Where you sometimes leave with your head connected.
Okay.
You are going to take this and you're going to you're going to use this string to debride or clean one side of your tooth, right? So that's it. So you're going to clean that and then you've basically cleaned this side of this tooth, right?
Mm-hmm.
But this side of this tooth hasn't gotten cleaned. So you're going to take this off and then you're going to use the same string to go down and now you're going to go this way. Okay?
Mm-hmm.
So by doing that, what you're doing is you're using the floss in between the same space, but 1 time you're going to use it for the tooth on the left and 1 time you're going to use it for the tooth on the right. And this is so important, number 1, to help make sure that plaque and food doesn't just remain inside your teeth that can cause cavities, but also it causes gingivitis. Gingivitis is inflamed gums or swollen gums. And a lot of people that say that their gums bleed when they're brushing or flossing their teeth, it's because you're brushing and flossing more. So I know it's like a paradoxical thing where it's like, well, I don't brush or floss because it makes my gums bleed. And it's like, no. The more you brush and floss, the less your gums will bleed. So bleeding gums is a sign of unhealthy tissue.
Yeah.
So doesn't mean that that's going to last forever. Usually epithelium turns over every 2 weeks or so. So if you brush and floss every day for 2 weeks, by the end of that 2 weeks, your gums will not bleed anymore. But it just takes that commitment to doing it.
Yeah, like builds up a tolerance, right?
Builds up the tolerance, and then also, it also just essentially cleans out all that plaque, all that bacteria, and that epithelium that grows in is all new. So there's no reason for that tissue to be unhealthy because it's already been cleaned out.
Gotcha. And so when you were showing the floss, do you go as far up to where your gums are?
Yeah, exactly.
Yeah.
Yeah. And then even underneath your gums, you want to just kind of, if you're flossing at first for the first time in a long time, or, once every 6 months when you see your dentist, just go slowly. You don't have to like rip the floss down and just like jam it in there. That kind of causes a lot of pain and discourages people. Just kind of gently slide it down and then just kind of massage your gums, go up and down. And the more you do it, like I said, I promise you, within 2 weeks, you will go from having painful bleeding gums to having the healthiest gums in the world. So just keep on it.
And you mentioned brushing your gums too. Like, I bet you there's a lot of people out there who are not brushing their gums because that probably doesn't feel good.
Gentle brushing. Again, just to make sure that you're cleaning that food that's just stuck in that sulcus area where the teeth are meeting.
Well, what about mouthwash?
Mouthwash is great. So mouthwash is great. There's a couple of really great ones. Listerine makes a great one.
Brand dropping.
Yeah, Act makes a great one. I receive no financial consideration for any of this, I promise you. But anyone, I actually have one here. So this is one that we use for kids, ones that say 0 alcohol in it, because it tends to be a little bit easier. If for some people that have more sensitive mouths and gums, you can use the ones that have 0 alcohol. But you do want to use one that says Total Care. Basically, you want one that has fluoride in it, because again, what we're trying to do is just get that topical effect of it. We don't need that systemic effect of fluoride, of swallowing the fluoride. Just swish and spit. Again, that's just going to help coat that outer enamel with fluoride and make your teeth more resistant to acid.
Very cool. So there we have it. Oral health and cleaning our teeth and cleaning our mouth is super important. It affects so many different areas of our body and our overall health. And these are great tips. I've learned so much. I really have. I wrote all these things down, and hopefully everyone listening, I'm sure, has learned something or taken something away from this. And I really, really appreciate you coming on. Is there any final thoughts that you have on the topic of why wellness, or anything else that you want to say before we sign off?
I think treat your body well, treat your brain well. You only get one. So just feed it what it wants. Drink a lot of water, get your rest, get your sleep, take care of your body, and it'll pay its dividends back in spades. And everyone by age 1 is what we tell our parents. So every child by age 1, we want to see at the dentist. So it's never too early to start by their first birthday. And take care of your teeth, please. Your dentist and hygienist will love you for it.
Yes. Thank you so much. Yeah. And there's so many parents out there who are listening, I'm sure. And I actually had no idea how young you could start sending your kid to the dentist. And I think that everyone will appreciate and benefit from all of the knowledge that you've shared with us today. I'm sure there's so much more that we could talk about, but we would never get off, but maybe there will be a round 2, right? Awesome. Thank you so much, Amar. I appreciate it.
Thanks, Gina.
And that does it, guys. Thank you so much for listening through to the end of that episode. I hope you'll share this with your friends, your family, and your network so we can continue growing this community even more and hear the stories that have yet to be told. Please let me know your thoughts too. Reach out. Tell me what you've learned. Tell me what's resonated with you. And let me know who you want to hear from next. I can't wait to talk to you guys soon.